March is Colon Cancer Awareness Month, and this month is dedicated to promoting the importance of getting screened for colorectal cancer and creating healthy habits to reduce your risk of developing cancer.
And in this month's Eye on Health, I found out that screenings alone can cut your risk of getting colon cancer in half. And for one patient we talked to, knowing that made this an easy decision. For some people, the doctor's office is where they will have some of the most difficult conversations. As a physician, Dr. Christopher Hall knows this firsthand.
This can be a difficult job.
Especially when he talks to some of his patients about getting a colonoscopy.
It is not often an easy discussion.
He tells me it's usually something that patients don't want done, but it really is important and potentially life-saving. Dr. Hall said regular colorectal cancer screenings can reduce your risk of developing colon cancer between 50 to 75%. He said it could reduce your risk of dying from it by just as much.
Those are impressive numbers.
Cancer screenings used to be encouraged for patients starting at age 50. Now, doctors are having this discussion much earlier, starting at age 45.
It changed because we're starting to see more cases of colorectal cancer in younger individuals. So age 45, 48, 50, and when we started screening at age 50, we were missing many of those.
Chuck is 46. He admits he was a year late, and this is a major concern. While men and women are equally likely to have colon cancer, doctors tell me men will likely develop cancer 10 years earlier than women.
Because my father's medical history is pretty unknown for me, he was like, let's be thorough, let's just be safe. And I took his suggestion and said, yeah, let's do it that way.
Screening are important because it is preventive, and cancer is one of the highest reasons for mortality in the country.
Screening early helps doctors detect potential problems before it's too late. Polyps, similar to the ones that we're showing you on the screen, were found during Chuck's colonoscopy. Doctors removed them. Gastroenterologist Dr. Zuhair Yaseen said that screening rates are not quite where they want them.
This is a common cancer. About 150,000 cases a year is diagnosed with colon cancer in the US, and 50,000 people are going to die from colon cancer. There are a lot of people just never really come to the doctor for this unless they're sick, and we really want to bring those in. Don't be afraid. Colon cancer is preventable.
Dr. Yaseen admits a colonoscopy and the preparation for one can be hard, but after the procedure, he commonly hears one thing from patients.
They say, oh, it wasn't as bad as I thought.
Not that it's not a big deal, so I don't want to minimize it, but it's not that scary. It's done and over with. The prep isn't the most fun part, but once you get done with that, you get done, and then hopefully somebody can go with you and have a pretty decent lunch.
There you go.
Other procedures and tests help screen for cancers in addition to a colonoscopy. Your doctor can advise you on which is best for you.